Welcome to this explainer. If you're joining us today, it's very likely because you, or maybe someone you love deeply, is currently navigating the often complex world of fertility care. And right off the bat, I just want to say I am so glad you're here. Today, we're going to be acting as your supportive guide through a really important diagnostic step your doctor might have brought up, the diagnostic laparoscopy. Our goal? To take the mystery completely out of this procedure using the clear, structured slides we've put together from our source material. By the end of our time together, you'll have a really solid grasp on what this is, why it helps, and exactly what you can expect.
Because, let's be honest, navigating fertility care takes an incredible amount of courage. It can honestly feel like a giant maze of medical terms, tests, and waiting. We absolutely understand the emotional weight of this journey, and that's exactly why this explainer exists. We want to empower you with clear, direct knowledge. Because when you understand the tools your medical team is using, well, that maze becomes just a little less intimidating. We're right here to walk this path with you, step by step.
So let's look at this as just a step in your journey. You see, sometimes standard tests just don't give us the whole picture. In those moments, doctors kind of need to act like detectives to find the hidden answers behind infertility. They need a closer look, and that is exactly where our topic for today fits in.
Moving into what a diagnostic laparoscopy actually is. I know, it sounds like a big, intimidating medical word, right? But as you're going to see, it's actually an incredibly helpful and precise tool used by fertility specialists. So laparoscopy is an invasive diagnostic procedure, but it's often beautifully referred to as keyhole surgery. Why? Well, instead of making large cuts, doctors use a really specialized telescopic camera system. This tiny camera allows them to clearly and directly visualize your abdominal organs, things like the bowel and liver, and most importantly for us, the reproductive organs. It literally gives them a high-definition, real-time view of the uterus, fallopian tubes, and ovaries, so they can see exactly what's happening inside.
Which brings us to the next big question: when is it recommended? Now, you might be sitting there wondering, wait, does everyone going through fertility treatments need this? And the short answer is no. Nowadays, a laparoscopy is actually not done routinely in a standard infertility workup. It's specifically recommended only when doctors find particular clues that really warrant that closer, inside look. Let's break down exactly when doctors decide they need to investigate further. A laparoscopy is typically brought up when previous exams point to a few specific scenarios. For instance, if there's a history of a sexually transmitted disease, there might be a risk of intra-abdominal adhesions or infected tubes that just have to be checked out. Or perhaps there was an abnormal ultrasound finding that looks a bit suspicious and needs more analysis. And finally, if a patient is experiencing unexplainable pain in the lower abdomen, well, this keyhole camera is amazing at helping doctors figure out the root cause. Now, one of those specific, suspicious findings on an ultrasound might point to endometriosis. Let's completely demystify this term. Endometriosis basically occurs when tissue that normally lines the inside of the uterus somehow implants outside the uterus. This out-of-place tissue can form cysts or scarring, which, as you might guess, can significantly impact fertility. The telescopic camera used in a laparoscopy, it is the absolute perfect tool to spot these hidden patches of tissue clearly.
Another complex medical term you might hear, and another common reason for an abnormal ultrasound, is a hydrosalpinx, okay? Big word, but it simply means a fallopian tube that has become filled with fluid. A healthy, open fallopian tube is absolutely crucial for natural conception, so if fluid is blocking it, your doctors need to see the extent of the blockage. A diagnostic laparoscopy allows them to view that tube directly and really assess its health.
Now, while the laparoscope is busy looking at the outside of the reproductive organs within the pelvis, the laparoscopy should actually always be combined with a hysteroscopy. A hysteroscopy is used to assess the inside of the uterine cavity. So by combining these two procedures, your doctor is making sure that absolutely no detail is missed, inside or out. It's a really comprehensive look.
All right, moving right along to the procedure and recovery. We've talked about what it is and why it's used. Now let's talk about the actual day of the procedure to help replace any fear of the unknown with clear, solid expectations. Let's look at how the procedure unfolds, just to build a picture of your day. First and foremost, you should know this is performed under general anesthesia, meaning you'll be completely asleep and carefully looked after. You won't feel a thing. Once you're asleep, the surgeon makes a very small cut, typically right around the belly button. Through this tiny incision, gentle carbon dioxide gas, or CO2, is introduced into the abdominal cavity. This basically just creates a little bit of space so the organs aren't resting right on top of each other. Finally, the laparoscope camera is inserted into that space to begin the visual assessment. And if corrective surgery is needed, additional small incisions can be made to insert other instruments right then and there.
Honestly, the most crucial point is knowing what to expect after you wake up. Following the operation, it is completely normal to experience some symptoms that could last for a few days. Think of them as temporary signs of a healing body. You might feel a bit tired, have some mild nausea, and feel some pain around those small incision sites. You may also experience abdominal pain or cramps, tenderness, abdominal bloating, and even some shoulder pain, which is actually very common from the CO2 gas. You might also notice a small amount of vaginal discharge or bleeding. Seeing all these symptoms listed out helps normalize them, right? They're an expected part of the rapid recovery process, so there's no need to panic if you experience them.
Let's move on to safety and advantages. Anytime we talk about a medical procedure, it is entirely natural to ask about safety. Let's look at the incredible safety profile and the specific benefits of choosing the laparoscopic approach. Go ahead and take a deep breath, and just consider this number, less than 1%. While laparoscopy should absolutely be avoided if it's not strictly necessary, because, let's face it, there's always some risk with any surgery, the risk of serious complications here is incredibly low. It is less than 1%, especially when the procedure is performed by a highly trained fertility surgeon. I don't know about you, but I find that to be a massive sigh of relief.
We do want to be totally transparent, though. While very rare, the complications associated with laparoscopy do include the possibility of damage to surrounding organs in the abdominal cavity and pelvis, like the bladder, uterus, ureter, bowel, and blood vessels. Another really important point our source makes is that unnecessary interventions on the uterus or ovaries should be rigorously avoided. Why? Well, because unnecessary tinkering can actually decrease the chance of pregnancy or increase risks during pregnancy. And this is exactly why it's only recommended when specific clues are present and performed by specialized experts.
To truly appreciate this procedure, we just have to compare it to how things used to be done. Laparoscopy involves small incisions, which means far less postoperative discomfort. It boasts a rapid recovery time with markedly reduced hospital stays and less adhesion formation. Conventional open surgery, on the flip side, involves larger incisions, a longer, much harder recovery, and significantly more discomfort. This keyhole method, it's a major advancement in keeping you comfortable and moving you forward.
And that brings us right to the end of our structured look at diagnostic laparoscopy. We've seen how this incredible tool allows doctors to act as detectives, safely and gently peering inside to find the answers you need to progress on your fertility journey. Understanding the how and the why is really the first big step in taking control of your care. Armed with this knowledge, you can have a much more confident, informed conversation with your fertility specialist. So I'll leave you with this thought. Are you ready to take that next step and find your answers? Thank you so much for learning with me today.